Okay, good morning to all of you out there. We're sorry for a slight delay in our opening this morning. It is a morning of technical adjustments because, as you may have noticed, it is quite dark out here. Actually, in-adjust ko na po yan para makita nyo kami at ang background dahil makulimlim, madilim, umuulan na naman because there is a typhoon in the Philippines. Welcome to the program agenda. I'm your host, Cito Beltran. And you are watching us via Cignal TV, channels 8 and 250, as well as on facebook.com/OneNewsPH. Para doon po sa mga hindi makatanggap ng balita, pwede nyo kaming mapanood. Just go to facebook.com/OneNewsPH. You can also watch our replays on YouTube by basically typing One News PH. Pasensya na, tumatanda na ang Kuya Cito, kuminsan malilimutin, kuminsan low energy, trying to pump it up. Okay, today is September 7, 2021. It's a Tuesday. Medyo makulimlim, madilim, as I said, and it is because of the typhoon. But first, before we go into interviews about housing and also about medyo nagkakainitan po sa Metro Manila, there the powers that be in the Philippines are arguing over the decision of the national government to go from quarantines to granular lockdowns and lifting the travel ban to 10 high-risk countries back and forth, and medyo nagkakainitan. So we will discuss that during the program. But before that, let's go to the news para sa inyong hindi nararating ng balitang papel, ang newspaper, The Philippine Star. Let's go to the front page of The Philippine Star. And there you have it. The main headline is the announcement: granular hard lockdowns set in NCR. Metro eases to GCQ even as new COVID cases hit 22,415. Metro Manila will be put under GCQ from September 8 to 30, but they will apply, the government will apply granular hard lockdown. And this means that under granular hard lockdowns, if a mayor or a barangay captain decides that they have more than the normal case of COVID or Delta case, they can declare granular hard lockdowns. Ano ang kaibahan? Sa granular lockdowns, even the authorized persons out of residence will not be allowed to go outside their residence or return to their residence if they were outside when the hard lockdown was declared. Inulit po natin yan, ha? Maski na A4 kayo o authorized person out of residence, if your area, your barangay, your street has been placed on granular hard lockdown, sorry na lang, walang lalabas, walang papasok. Okay. And the government has, the national government has declared that the decision will be up to the mayors, up to the barangay captain, and this applies only to Metro Manila. Inuulit ko po, NCR lang po ang sakop ng granular hard lockdown policy. And the government also said, sana hindi na una ang dada sa gawa, that when the granular lockdown is imposed, there will be aid. May ayuda o baka naman may food basket na ipapadala sa inyo. Okay, let's go back to the front page of the Philippine Star. On the upper portion, header of the Philippine Star, you will find face Senate. Harapin nyo ang Senado according to Senator Christopher Bongo. Okay, sinabi, Senator Bongo called on those who have been invited, hindi naman necessarily implicated, invited to the different Senate investigations, particularly of the Senate Blue Ribbon, to present themselves, to participate. Okay? Particularly Michael Yang. Okay? So, ayun po, no? Sinabi na ni Bongo, attend kayo. Then for COVID-19 cases, you will notice on the front page, it is now in a record high. 22,415 cases as of September 6 yesterday. Ang new positive cases, and then the number of deaths, 103 na naman. So that's the latest for COVID. Now, as far as the granular hard lockdowns are concerned, a storm type alerts to give flexibility. Now, lipat na muna tayo ulit sa front page ng Philippine Star. A storm type of alert will be given to advise people about the situation. Now, ano itong storm type alerts to give flexibility to LGUs? The LGUs will have the authority to decide whether they will declare alert level 1, alert level 2, 3, or 4. Parang typhoon, parang bagyo, storm type alerts. It will indicate the level of concern and level 4 being the worst. Okay. In the middle of the photo, you will see, okay, going back to the front page again, you will see Secretary Harry Roque then demonstrating or motioning towards two models for the PPE. Parang, bakit? Anyway, beside that story, you have a story, frustration aired over government COVID response and priorities. Vice President Leni Robredo and City of Manila Mayor Isko Moreno shared their frustration over the government's COVID response, with Vice President Robredo pointing out that instead of spending his time and energy criticizing people and wasting time in their press conferences or talk to the people, they should concentrate on managing COVID. And Isko Moreno, for his part, repeated that has already been said many times by other critics and legislators, how appalled or surprised or shocked they were to discover the amount of money spent by the DBM and the DOH for PPEs. Now, on the lower half of the page, okay, DOH, okay, maintains that the Philippines is still the under high risk category. Okay, we have a positivity rate of 32%, a daily average daily attack rate of 15.79 out of 100,000 tested, and 11 regions at high risk for COVID cases. And these are the National Capital Region, Calabar Zone, Cagayan Valley, the Cordillera Administrative Region, Central Luzon, Northern Mindanao, Ilocos, Davao, Caraga, Western Visayas, and Soc-Sargen. And then further down on the front page, you have a photo of Leia, okay, Leila, sorry, medyo, naalala ko yung kanta ni, Eric Clapton. You have that on the left side, bottom side, you have a photo of that young Filipina, Ecuadorian, Canadian citizen, Leila Fernandez, upsetting German tennis champion, Angelique Gerber at the 2021 US Open in Flushing Meadows. Before that, if I remember correctly, Leila Fernandez also upset, I think Naomi, I think the US champion, and yeah, yan. Naomi Osaka. Naalala ko yung Naomi Osaka, nakalimutan ko. Okay. Going back to the front page, Vice President, let's go back. Vice President Leni Robredo said, dili man siya tatakbong senadora. She will not run for senator in 2022. Mas mabuti pa raw tumakbo na lang siya, if ever, to run for a local position, which some people have been saying, or maybe retire or help in the next administration. Okay? Medyo, I don't know, the help in the next administration, parang baka naman maulit na naman yung naging experience niya in this administration. And, okay, this is the important part. Storm Jolina, kung tayo po ay madilim ang paligid, like you see in the background, it is because there is Typhoon Jolina. Okay? And it was spotted in Gian Samar, now is being tracked and headed. Ang prediction nila, by tomorrow it will make landfall somewhere between Isabela or Cagayan, and will exit the country by Friday. So God willing, yung ating weekend, this coming weekend, will be okay. Ang problema lang, there is a second typhoon. Sabi ko naman sa inyo, maghanda na kayo, mag-ingat na kayo. Because right now, yesterday, if you remember, I called out the fact that wala pa tayong mga super. Puro mga regular serving lang ng typhoon. So kayo, if you have trees, big trees near your homes, please, may I suggest, paggupitan nyo muna. Pa-haircut nyo yung inyong mga puno. Check your drainage, check everything, because we did it. We spent 2 weeks trimming trees here in our place kasi when Typhoon Glenda hit us, we almost lost our garage dahil nadaplisan kami ng isang palm tree. Okay, and last but not the least, on the front page, we have that photo of sabi nila, MMDA cleaners daw. Pero baka hiram lang yung uniforme na yun. We have 2 workers, local workers, cleaning, washing chairs, tables in a public school. And the purpose of that is in preparation for the opening of classes in public schools. Now, the president has said that he would consider pilot, subok lang, pilot face-to-face classes in areas where there are low, there you go, on the bottom right side, where there are low incidence of COVID cases. Ang problema, not in Metro Manila, definitely, and not in the 10 other regions we read this morning. So, if you belong to any of those 11 regions, including Metro Manila, wag muna kayong umasang may face-to-face class. Okay. And today's quote comes from 2 Corinthians chapter 1, verse 4, who comforts us in all our tribulation, that we may be able to comfort them who are in any trouble by comfort with which we ourselves are comforted of God. In other words, kasi hirap pag iba-ibang version ng Bible, magkakabalok-baloktot dila natin. Madaling salita, in short, we should comfort others. as God comforts us or send other people to comfort us. Kasi alam niyo po, many of us gumagalaw lang kasi may namatayan. Gumagalaw lang. We respond because someone is in dire straits. But, sometimes all it takes is a phone call to ask, how are you? Are you doing fine? Especially yung medyo alam nyo, elderly na, alam nyo na unemployed, etc. Just comfort them and say hello. I'm sorry if I'm not able to call everyone I know, but I hope that if they at least get to watch this program, that I care for my friends, my family, my neighbors, and I hope that the God of comfort who comforts us, okay, in all our tribulation, that we may comfort others. Will comfort you. Thank you for joining us this morning. Let's now move to our interview. One of the regular agendas that we work on here on Agenda is the matter of housing. Kasi alam nyo po, especially those in Metro Manila, sa Metro Cebu and Metro Davao, even Baguio City, the high incidence of COVID all over the country is now more prevalent in areas na ika nga gapapil lang, paper thin walls, wall to wall, very low quality or actually no quality housing kasi barong-barong lang, squatters area, etc. I'm sorry, but I have to use that because that's the term of my generation. Housing is a very important, it is a basic requirement. Shelter is a basic requirement of people. And so when I heard of the Organization of Socialized and Economic Housing Developers of the Philippines, or OSHDP, from one of my contacts, Almira, I requested, pwede ba natin ma-interview? So with us is the OSHDP Inc. Representative. He is an engineer recognized as one of the country's housing sector leaders for over 3 decades. And he was president of Camellia Homes and was also past president of the Subdivision and Housing Developers Association of the Philippines. Let's bring in Engineer Marcelino Mendoza. Engineer, good morning.
Good morning, Cito. Am I quite clear?
Yeah, malinaw naman.
Yeah.
Okay.
I used to watch even your father, Cito Beltran, straight from the shoulder.
You mentioned it. It was his death.
That's how old I am.
Yeah, it was, you mentioned it, it was his death anniversary yesterday. So kaya medyo struggle ako this morning to get out of the bed. Anyway, let's put that aside. Engineer, you are in Socialized and Economic Housing Development. Now, pwede bang malaman for our viewers, what exactly is Socialized Housing and Development as it pertains in the Philippines? Kasi pag sinabing socialized housing, dikit-dikit, para bang pinagtabi-tabing kahon, okay? And where is socialized housing in the Philippines right now?
Yeah, let's define some terms first. No, socialized housing, as it is known in the industry, is usually defined by price ceilings or the cost of the house. This is set by the government. There is price control. So this is the housing that is lower or less than 480,000 for row houses. No, so this is the target beneficiaries would be at the bottom, maybe bottom 50% of the income deciles in the Philippines. So that is socialized housing, although somehow there is confusion as to mass housing, as to low-cost housing. But socialized housing is for the marginalized and the lowest 50% of the income deciles.
Oh, okay. So 400, it's based on price set by government.
It's price controlled.
Okay.
There's a cap.
Okay. Kasi when I do my research, I notice a pattern abroad. Abroad,
Yes.
housing is based on square meter. And
Metric.
many, huh?
Yeah, metric. Yeah. For
Yeah,
most of the
square.
world.
Yeah, square meter per person. So parang
Yes.
hindi to based on cost eh. Kasi kung ibe-base mo on cost, pagkakasyahin mo yung footprint base
Yes.
sa construction. Now, in the Philippines, is there what is the basic footprint space in those 480,000 homes?
It's 240 square meters. To 24 square meters, rather.
24 square meters yung isang floor.
For bungalows. So if you have a two-story, well, you can more or less double it if it's two-story. But of course, the price increases, the cost increases.
Okay, and are we still building homes on based on traditional methods, or have we started to adopt, like the technology from abroad that makes it cheaper to build this? Thus, maybe we can make better homes.
Um, well, the experience is mixed. No, there have been houses that are built with new technology like prefabricated houses. There are even houses that uses bamboo as
Hmm.
the traditional bamboo as a building block, a building
Yeah.
material. But this is wala sa scale. It hasn't come to the scale that it can be considered really mass housing.
Okay. Okay. Now, engineer, matanong ko lang, no, your Organization of Socialized Economic Housing Developers, what do you exist for? Kasi, di ba, meron tayong mga samahan that are lobby groups, may mga samahan that are proponents of for progress, for change, etc. What is the spirit behind the Organization of Socialized and Economic Housing Developers?
Uh, OSHDP, or the Organization of Socialized and Economic Housing Developers, is basically an association of producers or manufacturers in industry parlance for other industries. So we build the housing. No, um, some are most are developers, some are contractors. There are affiliate members who are housing NGOs. So our main advocacy is really to provide housing for the socialized and economic sectors, something which we feel is really very necessary. Although this is just one of the options for for the private sector to contribute to socialized housing in the country. So we are producers.
Okay.
In
How many strong is your membership?
We have 100 developers and affiliate NGOs all over the Philippines. This is national.
Okay, now in the past, the people have been worried, if not critical, of socialized housing because of the low cost, therefore low quality construction. I think I can remember Cherry Hills, mga iba-ibang mga project na nag-collapse yung housing. What has changed in the market or in your sector as far as the integrity, quality of socialized housing, and the quality of life that it provides?
Well, first of all, we would want to distinguish between government housing and socialized housing by the private sector. In the private sector, there's a lot of competition. So that ensures that there is, a competition also in quality as well as in location of project. So that is a natural barrier to let's say sloppy construction, and we have always made sure, because Cito, even in socialized housing, the private sector maintains the housing development even after sale. And this is something
Okay.
which is very important. We
Okay.
want to maintain the quality.
Well, good that you made that distinction kasi ako honestly even I thought that you guys were, the go-to producers of government. So you guys have nothing to do with government housing. You are investors, builders, developers, and and you also maintain these projects.
Yes. The
Mm,
government housing is basically National Housing Authority and the
okay.
Social Housing Finance Corporation. So we do maintain, and that is the difference. We feel that we want to maintain the value of the properties. So that is
Mhm.
the main difference.
Okay.
In the government, it is mostly akin to contractor type housing. In other words, the government awards contracts for the construction of these units. For example, those that are affected by government projects, those that are affected by typhoons. So these are the kind of houses that NHA is building.
Okay. Now, can you give us examples of some of those places? Huwag kang mag-alala, engineer. Wala akong hidden agenda, no? Gusto ko
Baka
matuto.
naman tayo ng advertisements.
Okay. No, but can you give us examples of some such subdivisions or projects? Kasi it's good to know that I think yung mga projects nyo is more for the middle, lower class. Hindi naman yung indigent or government housing eh. But there are people who are wondering, meron pa ba kaming mabibiling bahay sa kung bago kami mag-asawa, etc. What sort of can you name some of those projects?
Well, Fiesta Communities is very strong in the central Luzon and the Pampanga, Zambales areas. There's Bria
Mhm.
Homes, there's Lumina Homes. So these
Lumi
are some of the projects that I can mention. Some are
Fiesta,
not branded. They are
wait,
not
Fiesta,
branded.
Lumina,
Bria,
ano pa yun? Via.
yes.
Okay, okay. Kasi
No,
ano
I want to make a distinction because we are limited by the funding. In other words, for example, we cater to the lowest or the minimum wage earners.
uh-huh.
But that in itself places already a floor, which means that we can only cater to the minimum wage earners. Below employees or even, let's say, informal workers that are earning below the minimum wage, that is not, we cannot cater to this because simply there is no funding. For example, we call it a takeout, or the mechanism by which these buyers eventually owes or takes out or applies for a loan with pag-ibig fund. So we're catering to minimum wage workers, both formal and informal.
Okay, you're catering to minimum wage earners, both formal and informal. But how on earth, and I mean this sincerely, how on earth can these people afford a 480,000 house?
Yeah, basically the interest is subsidized. For example, now commercial rates would be, let's say, 7% to 10%.
Yeah.
But pag-ibig fund grants half interest, 3%, 25 years. And that basically is the reason why a lot of minimum wage workers have been through these years able to acquire their own, well, albeit small house. But this is just a starter house. So they
Uh-huh.
can improve this, they can, extend expand it. They can even buy another house later on.
Okay. Well. I mean, you're right there. I'm just shocked that because I live here in Lipa now, and I know that some people are hand to mouth existence, two, three families in under one roof, and so I kind of wonder how can people even get out of that situation. So you're saying that pag-ibig gives the interest, etc. But employment is not a certainty in these times. How does that affect your projects or your viability when people have no guarantees of employment under COVID?
Well, definitely, there has been a lot of second thinking, no, rethinking on whether to buy a house and not now. Um, this is a long-term investment in housing. It is while it is a necessity, it is viewed on the basis of what is your outlook on the future, particularly on what your job security is,
Mm-hmm.
or even the business. How is business going to be in the next not only 1 year, or 3 years, 5 years maybe, because these are
Yeah.
long-term goals. So,
Okay.
admittedly, there has been a lot of rethinking now on whether to buy now, maybe postpone your purchase, or even perhaps it's not even in the thinking process at this point in time for some people.
Yeah, no choice. Now, engineer, may I know, because you know how to build houses. I've done some construction work myself here and abroad, so I'm familiar with that. That's not the problem. The problem is sustaining the viability, keeping the people interested in housing. So I'm sure that you and your members have come up with a list of things that need to be done by government or by someone else to ensure that we are able to provide housing to people. Can you share some of those possible things? Because, like you mentioned, Pag-ibig is giving loans, but if people are unemployed, what does the government have to do in order to sustain or even improve housing services in the Philippines?
Yeah, I look at this as systemic. This whole concern now about the housing crisis. It's not. It has something that has built up over the years. Now, what is our take on this? Number one, we have really, the government as a whole, we have underinvested in housing. For example, similarly situated countries like, Thailand is 5 times spending as a percentage of GDP. Malaysia is 3 times. Indonesia 2 times. Even Bangladesh, which is one half of our GDP per capita, is spending twice. Not to mention Singapore, that's out of the league, 13 times. So government has to commit to spending to public housing. That's number one. Number two, regarding urban planning, we have to connect the dots. Because we look at housing as housing per se, but housing should be connected to traffic and congestion, to jobs and livelihood, to now public health. It should be near, places of hospitals, even doctors. This is something that has not been, in a way, largely given much attention through this 20 years or so.
Okay, so anything else?
Well, the government now has to remove all regulatory bottlenecks. No, we know that housing is one of the most regulated of industries. So, we're looking at permitting. We're looking at, ARTA is doing a lot along these lines. But apparently, it's also facing roadblocks from some government agencies. And in other countries, the United States, for example, Australia, Construction and housing has been really a bulwark of economic activity. And even at this time, when we should be thinking about post-COVID, housing and construction is a labor-intensive industry. In other words, you don't have that much or that many skilled workers that can propel economic recovery. There's a great multiplier effect with so little in funding except to make it as a priority. I think more than ever, COVID-19 has emphasized and maybe put into proper perspective the importance of housing and housing construction as a tool for economic recovery.
Well, that's a very good point, engineer, because as it turns out, the government or the Duterte administration has been pushing on build, build, build. But when you compare all of these infrastructure investments side by side with public housing or socialized housing, housing still is build, 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 but it benefits people directly and motivates them to invest on a future. So I get your point, and that's why I asked you for this list, this to-do list of the national government. And I hope that we can continue our conversation in future programs because those are the things we need to hear. We need to understand why socialized housing, public housing, or housing for that matter has been on the low priority of the government. Anyway, Engineer Mendoza, I'll have to shift gears because there are other topics on the wing. But mind you, we will be calling on you again in the future to continue discussing public or socialized housing para naman malagyan natin mabigyan ng bahay or makabili ng bahay ang ating mga kababayan. Thank you very much, Engineer.
Thank you very much. As we always say, housing and construction are part, is shovel ready. We are ready anytime to build a lot of houses. We just need a lot of support, both from local as well as national government.
Okay. Thank you very much, Engineer. Have a good day. God bless you. That's Engineer Marcelino Mendoza of the OSHDP, or Organization of Socialized and Economic Housing Developers of the Philippines. We'll go for a quick break, and when we come back, pag-usapan naman natin yung umiinit na sitwasyon regarding the decision of granular lockdown replacing quarantine classifications here on Agenda. Welcome back to the program Agenda. I'm your host, Cito Beltran. And at this point of our program, let's bring in a physician, our hindi naman po natin consultant, no? Someone we love to consult with because he is a doctor who actually treats COVID-19 patients. He's not what you call a media kind of doctor na mas madalas pa sa media kaysa sa clinic. He is also a member of the vaccine expert panel. He is the chairman of the Adult Infectious Diseases and Tropical Medicine Department of the San Lazaro Hospital. Also assistant professor at the University of the East, Ramon Magsaysay Memorial Medical Center, or UERMMC. Let's bring in Dr. Rontgene Solante. Doc Rontgene, good morning.
Good morning, Sir Cito. Kumusta?
Okay, medyo nagkakainitan. If you've been watching the news, following social media, there is a friction between those who are pushing for granular lockdowns versus those who are saying we are all already experts in this ECQ, GCQ, blah, blah, blah. So, what is your assessment regarding the granular lockdown approach in the midst of the highest number of cases? Kumbaga, tama ba? Is this the right time to do this? Open the door and just close open, close open?
Yeah, I just give you my opinion on this. No, we have had ECQ and MECQ for the past 2-3 weeks, and yet the cases are not going down. No, give you some background dito sa mga hospitals. ERs are still full. Pumipila pa rin ang mga pasyente. I have patients na hindi nakakaabot sa emergency room, sa bahay na lang, and then they die. And then sa mga ICU ngayon, especially here in San Lazaro Hospital, we are now 190% fully occupied. So ibig sabihin, mas sumobra na yung mga beds namin allotted for the ICU. And that has not changed for the past 3 weeks, even with ECQ, even with the MECQ. And now we're going to a GCQ. Ang pangamba ko lang dito, meron, okay naman ako sa granular lockdown, no? Pero at this point in time, napaka-clustered ng mga kaso. Kumbaga, buong NCR. So ang tanong ko lang, kung i-granular lockdown, para mo na rin nila-lockdown ang buong NCR kung ganun ang mangyayari. And I don't know how effective it is. Especially during this time na mataas talaga pa rin ang mga kaso at mataas ang hawaan.
Well, that is a very good point, Doc Ronjin, because I really, or I think a lot of people didn't see it that way. Ang feeling nila is pag nag-granular lockdown, bara-barangay lang ang ila-lockdown. But you're pointing out that the number of cases in the entire NCR is so high that you would, if you follow that trend of thought or the thinking, di lalahatin mo yung buong NCR in a real hard lockdown.
Yes, because when we look at demographics of our patients here in San Lazaro and other private hospitals, hindi lang naman to nanggagaling ng Manila, no? Or like here in Manila, Quezon City, Caloocan, Valenzuela, sometimes as far as Cavite, no? Pasay, Parañaque, all of these are in these hospitals or in other private hospitals, no? So napakalawak ang distribution ng mga kaso. So I cannot imagine how the granular lockdown will be done and how it will start. Kasi nga sa lawak at saka hab ang distribution ng mga kaso. So that's my thought on a granular lockdown, especially now na ang taas talaga ng mga kaso ngayon.
Okay, can you explain? Kasi alam nyo, Doc, pag depende kung sino kausap mo, medyo iba na talaga ang mga sagot, no? Many people are still wondering, why do we have so many cases? Because we keep saying ECQ, hard lockdown, this lockdown, checkpoints, and yet, contrary to the expected results, the cases are going up. And some say, hindi kasi ang dami pa rin pasaway. And then, because it's Delta variant. But from what I've studied, Delta variant is 1:2 ang conversion or something like that. May nagsabi 1:8. Ano ba talaga based on the hospital floor can be the reason for these high cases?
Unang-una, napakataas talaga ng transmissibility nitong virus na to, no? Why did I say that? Because if you compare this surge compared to the previous, napakahaba nung nakikita nating surge. In fact, palagi kong sinasabi, we've been experiencing this punong-puno ang mga ICU namin since August, no? Or last week of July and until now. Compared mo sa mga previous case, mga surge na talagang after 2 or 3 weeks talagang meron talagang hupa ng mga kaso. And ang nakita ko dito is the household transmission, no?
Mm.
Ano ang ibig sabihin yan, no? Pag umuwi ka sa bahay, you have COVID and you don't know, you only have mild symptoms. A lot of these patients or na expose sa mga lumalabas, na yung mga lumalabas, walang mga sintomas or probably denied of any symptoms. So itong mga nakikita namin ngayon sa mga hospital, these are the people na mga vulnerable, but we already see people also, patients na less than 60 years old. In fact, medyo mas mataas-taas ang mga less than 60 years old. Mataas ang hawaan sa household. So people who are in the household na akala nila wala silang symptom, they go back to the work. Pagdating sa work, they also deny that they have symptoms or very mild symptoms or asymptomatic. Pwedeng naghawaan doon, tapos yung mga other people doon na umuwi na rin, doon ang hawaan. So I think that's how spread out ang hawaan ngayon compared to the previous variants of concern. Napakataas. And a lot of these people only have mild symptoms and they thought that it's not COVID.
Okay, Doc Ronjin, you were pointing out that if we do hard lockdowns based on data, based on number of cases and distribution of cases, i-lockdown mo na, i-hard lockdown mo na yung buong NCR. Now, this has been an argument, and I'm not trying to be bida or siga here, no, because I am just a talk show host, so to speak. But I have been saying that all along, that if you're going to contain this, you have to contain the population. But the government did a compromise. We will lock down the vulnerables like Beltran, who is a senior citizen, but we will let all the young people go out, go to work, etc. And now we have infections at home because the APORs went home to infect the vulnerables. Now, would you be would you agree if entire NCR was simply put on hard lockdown one time, big time? Do you think it will really make a big difference kung walang labasan, walang papasok, and how long should it be?
Yes, I go for that, no? Because what we're seeing now is talagang hindi na natin ma-control to kung ganito lang, no? And we are experimenting something na hindi pa natin nagagawa before in the midst ng ang taas-taas ng mga kaso, no? So that's just my point. If the trend will be like this in the next 2 to 3 days, 22, 20, 20, I don't think a granular lockdown can be the solution at this point in time because of the enormous number of cases that you need to really put a stop in the mobility of people in order to get what we want in terms of lowering the risk of transmission and lower the cases.
Doc Rontgene, I received some information, information a few weeks ago, where in Europe, I think it's in UK particularly, where they're already talking about dealing with COVID as endemic and not pandemic, meaning it's already on the ground, it's already part of our life, and we should treat the sick, the ones who need medication, hospitalization, instead of doing the quarantines. Kumbaga, nandiyan na yan eh. Gamutin na lang natin yung dapat gamutin. Now, what's your take on that?
Well, they are a country with big resources. Okay, even if they will limit their mobility, they have some tracking mechanism on how to detect those who are positive because their health-seeking behavior is more mature compared to us. Their mobility factor may not be as higher than us, no? Sa atin, ang taas talaga ng mobility factor, and that's why one person can be in 2 or 3 places in one day, and that's really a lot, no? And the population density is also very high in Metro Manila compared to some European countries. When you go to some European countries, even like London, you don't see this much of a density. So it's something that pwede natin gawin dito, but we have to be deliberate in terms of how to implement that and when should we start and how to start that.
Okay, so it still brings us back to your observation na at the end of the day, the granular lockdowns is not going to work because people will just keep going around and many of them, how many percent out of let's say 100 patients na napunta sa iyo o nakita nyo sa inyong mga clinics, how many percent are actually asymptomatic?
Actually, sa pag pumupunta kasi yan sa clinic or dito sa hospital, talagang all of them are symptomatic. And I will say 80% of these admitted patients, they always tells us that they have 2, 3 of their relatives are also positive at home with very very mild symptoms, hindi na lang pinapalabas kasi mas safe pa sila doon at saka they will just have to consult their doctor. So kung titingnan mo yung mga 3 or 4 symptomatic, then you'll have to estimate ilan doon sa household ang walang symptom but yet are positive and yet are going out because of work.
Mhm. Okay, now just a quick question for my education. People keep talking about hospital beds, COVID beds, etc. capacities. No, ang tanong, before all of this started, was there so many beds already? Kasi parang ang thinking ko, you mentioned 190% kayo, no? In capacity. It's easy to have 190% if you only had 100 beds to begin with and you're dealing with 1,000 cases. So the argument now that I've also been talking about is, we need more hospitals. If we don't have hospitals, let's put up field hospitals. Crazy ba yung suggestion na Doc Ronjin?
That's an important observation because kung nakikita mo ngayon mga hospitals, they are full of COVID patients, no? And in fact, mas limited na yung care natin doon sa mga non-COVID because ang crucial dito, Sir Cito, is the healthcare workers, no? Maski mag-extend ka ng mga beds sa mga hospitals, pwede naman natin magawa ng paraan yan eh. But what is the ratio and proportion of that healthcare worker and the patient? Because iba ang alaga ng isang COVID patients. Ang isang COVID patients, just like you're taking care of 5 patients, no? That's how intense when you are taking care of one single patient. Now, like in San Lazaro Hospital, one nurse will be taking like 5 or 6 COVID patients, and that's a lot. And then the next shift, and then the next shift, and then nandun yung fatigue factor, no? Walang problema sa bed capacity, pwede nating i-increase. Ang problema, meron ba tayong pwedeng ilagay na tao? And that's also the majority of hospitals now. Kulang talaga ang tao na magtrabaho sa hospital at this point in time.
Okay, you spoke of the situation in San Lazaro. With the number of COVID positive cases, how many percent are actually vaccinated?
Okay, that's a very good question. Out of the admission, 75% are not vaccinated. So, which means that only 25% are vaccinated. So, the difference between an admission and developing severe critical COVID is really the vaccine, no? Kaya napaka-importante ng bakuna at this point in time. So, mataas pa rin ang hindi nabakunahan pag tinatanong mo sila. Ang haba ng pila daw sa LGU, yung iba naman ayaw lang talagang magpabakuna. So these are some of the issues of patients when we interviewed them sa hospital.
Okay, now of those vaccinated, all of them are fully vaccinated naman.
Yes, meron din tayong mga partially vaccinated, no? And medyo mababa lang naman yung count ng partially vaccinated. So it's really like the majority are still the unvaccinated. In the critical unit, ganun din ang ratio and proportion, mas mataas din ang walang bakuna kumpara doon sa mayroong mga nabakunahan na.
Those who are vaccinated, who are in the critical care unit, are they there as regular patients who got COVID or are they patients with comorbidities? Kasi may mga diabetes, ganyan. Are those with comorbidities mostly?
In fact, sa data namin ngayon, mas mataas ang nasa critical ngayon yung mga less than 60 years old compared to more than 60 years old, no? So, dito natin nakikita ngayon, ang less than 60 years old, like, estimate 85% are non-vaccinated, 15% are vaccinated. In the 60 years old and above, 60% are unvaccinated, 40% are vaccinated. Mataas-taas din ang ano ng 60 years old because they have mga comorbidities, no? Some of the age group here are 75, 80, 85. You would believe they are not going out, but they got their infection because somebody is going out every day.
Okay, yung question ko earlier, if we, not we, no? If somebody in government realize one morning na, this isn't going to work, let's just hard lock down entire NCR, how long does it have to be so we can safely say, pag ginawa ninyo ito, hard lockdown, one time, big time, hindi na kailangan ulitin to. How many weeks do we need to do it?
Siguro we will based on our experience before we did that, no, 2 weeks, and then we see the trend going down, and thereafter assess if we will continue or downgrade the quarantine grading.
Yeah, but 2 weeks, merong paumpisa pa lang, merong patapos na. Should it be 2 weeks or 3 weeks na talagang hard lockdown, nobody goes out?
Well, I cannot totally comment on that, no, but ang nakita ko lang based on that experience before na nung nagta-time out kami before ng 2 weeks, medyo gumanda ang situation.
Okay, well, Doc Ronjin, siguro I'm going to need an hour with you in the next episode because medyo this is not going to get any better, unfortunately. But thank you for your very direct analysis, insights on this. And please take care and continue to do your work that we really appreciate, especially when you do it in a critical public hospital. Thank you very much, Doc Ronjin.
Thank you and stay safe.
Okay, yan po si Doc Rontgene Solante, and you heard it from him, and we agree with Doc Rontgene regarding that matter because you can do all the versions of your lockdowns, but hanggat kumakalat, umiikot, gumagalaw, nakaangkas po ang COVID virus sa tao. Thank you very much for joining us this morning. Please take care. And if you are going to wander about, stay safe, wear a mask, social distance, and pray. God bless you. I'm Cito Beltran, and that's agenda for today. Keep it here on One News.